Well, here at home, provincial officials said that it would be the last public health measure to be lifted. We now know mask mandates for schools and most indoor settings will be removed starting March 21st. There's a lot of mixed reaction to this, of course. So joining me now to discuss the province's latest move is Ontario's Chief Medical Officer of Health, Dr. Kieran Moore. Dr. Moore, good morning. Thanks for joining us.
Good morning, Tammy.
First off, why March 21st? We heard you last week saying that it would be likely closer to the end of the month, which sounded like it would be good timing with March break. But why not wait the extra 2 weeks like many experts are asking for?
Oh, thank you so much. I just have to thank Ontarians. Our data is improving day by day. I think everyone acknowledges we peaked in January with an increase in hospitalization at that time, but our data has been improving day by day, and it's very, very stable now. Our purpose for having public health measures was to protect our health system, and have to thank all Ontarians. We've done very well. We were able to provide the right care at the right time in January to Ontarians that needed intensive care or hospitalization, and we're well past that now. And we have to acknowledge all the sacrifices people have made and thank all Ontarians for continuing to wear masks and protecting each other and getting vaccinated over the last several months. But we're at a very good place now. We have to make a decision to stop public health measures because they have to be proportionate to the risk. And the risk has been decreasing day by day, thanks to all the sacrifices and work that Ontarians have done.
You mentioned the data has been improving, but this is based on hospitalizations, obviously, but limited testing, very limited testing is being done, number one. And number two, with March break and a lot of people going around to travel, spend time with family, kids are going to be coming back to classrooms now without cohorts. And once again, this is a time where this virus could spread again. Why, again, not wait just a couple more weeks?
Oh, thanks, Debbie. So just to recall, it's now a person's choice to wear a mask. And I certainly encourage individuals to continue to wear a mask, but now it's your choice and to do a risk assessment at an individual level. The data that we've been talking about has been improving day by day. We still have good access to testing. So we're doing around 20,000 PCR tests every day. And the positivity of those tests is remaining very stable and low. We also have a very robust testing strategy with RATs. So students will still be giving out 3.6 million RAT tests. So those are rapid antigen tests every other week. So students will have access to those tests. They should screen every day before they go to school. If they have symptoms, stay home and use those tests. If you're an international traveler, you have to get tested before returning to Canada. So that is one level of assurance. And if you're an international traveler, you have to wear a mask according to federal law for 2 weeks upon return. So we'll have all these layers of protection still with us to keep the rates of infection low in our communities.
Now, you said yourself that yesterday you would be still wearing a mask in certain situations if you're going to a big box store or a crowded area, for example. So if you have chosen, you've decided that you wouldn't be comfortable in those situations, then why not just have the mask mandate itself, since we have been dealing with this for the past 2 years, go on a little longer, especially when it comes to those school situations?
Yeah, I know change is difficult, and we now are allowing individuals to make their own choices. Have to acknowledge we're one of the last provinces, territories in the Federation in Canada to have a mask mandate. We've been slow and cautious and prudent and responsible, but we've had to make a decision of when this ends, and it's now going to be an individual's choice. I know that's difficult for some. I have to acknowledge that there is some concerns out there, but I anticipate many Ontarians will continue to wear masks, continue to protect themselves and others. And I hope we remain kind and considerate to those that choose to wear a mask or to those that don't choose to wear a mask.
Will you be willing to bring the mandate back if trends start going up again?
Well, we'll certainly be following the data. I want to assure all Ontarians we're monitoring this on a daily basis with all of our local public health agencies. We'll be tracking all the surveillance data at our fingertips, and we will raise the alert at a community level or at a provincial level if we have concerns. And the major concern would be a new virus that could elude or escape from the vaccine. And we'll be monitoring that internationally, nationally, provincially. We've got a very robust surveillance system to monitor for that. And also have to acknowledge over 90% of our 12 and ups have been vaccinated. If you haven't, certainly with mask mandates coming off, I certainly encourage everyone to get their first, second, and or third dose of vaccine to make sure you're maximally protected.
All right. Thank you very much again, Dr. Kieran Moore, joining us, Ontario's Chief Medical Officer of Health. We appreciate your time.